Okay, for this one, we're just going to be looking a little bit closer at diffusion. And I don't know that I defined it in the last PowerPoint, but just to kind of take a minute to discuss how gas diffuses, particularly what we're going to be starting to look at is gas diffusion and transport within the body. So from the lungs to the bloodstream, and then from the bloodstream back to the lung. Big concept here is just diffusion always wants to go from a high concentration to a low concentration, and that's true of really any mixture or solution. So if you're thinking about gas as a mixture, we talked a little bit about that when we talked about Dalton's law of partial pressure. Oxygen is going to want to move from a high pressure to a low pressure. Same with CO2, and those are the two gases that we're going to be looking at a lot in this unit. So we did look at Dalton's law. Another one that we're going to kind of add to the mix is Graham's law. And for each slide where I have one of these physics laws, I have the real technical definition. Please don't worry about the technical definition. That is not ever how I'm going to exam you on it. That's not ever how I'm going to expect you to understand it. I have underneath each technical definition a much more direct concept. So for Graham's law, it says the rate of diffusion of gas is inversely proportional to the square root of its molecular weight. What does this mean for you? Light gases diffuse more rapidly than heavy gases. That's it. CO2 is much lighter than oxygen, so it diffuses more readily. But just bottom line, light gases much quicker than heavy gases. That's it for Graham's law. Fick's law, which is one that I use a lot. I'm just going to throw that out there. This is something that you guys are going to see a lot on exams and homework. Is a law that has a lot of application in our field. There's a couple components that we're going to talk about here. So Fick's law basically says the greater the surface area, diffusion constant, and pressure gradient, the more diffusion occurs. So what does this mean? There's three big components that we're going to look at here. For gas exchange to occur between the alveoli and the pulmonary capillaries, there has to be a difference in partial pressures, which creates a gradient. What does this mean? It means that if you're looking at the pressure of, in this instance, let's say the pressure of oxygen in the lungs, that has to be a different pressure than the pressure of oxygen in the bloodstream, right? Because you're wanting oxygen to move from the lung into the bloodstream. And in this case, we're talking about essentially around a pressure of oxygen at about 100 in the lung. And generally speaking, it's about 40 in the venous blood that's going to be coming into the lung to get reoxygenated. So that's one component of Fick's law. The second component that we're going to focus on and spend some time on is that there's enough surface area. So if you can remember back to some of the anatomy slides where it shows the alveoli and it shows that capillary bed that surrounds the alveoli, you can think about each one of those alveolar sacs as surface area. All right, so each alveolar sac in your lung has this bed of capillaries designed for gas exchange, and all of that counts as surface area. Anything you do to decrease your surface area is going to decrease your gas exchange. So things that could decrease your surface area, one example that we spent a lot of time talking about when we are discussing lung compliance is lung collapse or alveolar collapse. If you have atelectasis and those alveoli are not opened as much as they could be, they're not inflated enough, that's going to decrease your surface area designed for gas exchange. And when you think about what this gas exchange is doing, this is how we're oxygenating our bodies, so our tissues, our organs, and this is how we're removing our CO2. So that surface area is a huge component to how this is allowed to happen. The last component that we're going to talk about is that the membrane is thin enough. So you're going to hear it called an AC membrane. And all that means is A, alveolar, C, capillary membrane. So When you think about how the interaction is going to go, this capillary bed is wrapped around the alveolar sac, and it's trying to participate in gas exchange. We know that they have the type 1 pneumocytes that are very, very thin, just one cell layer thin. And so you want to make sure that you have this area that's primed for gas exchange, that's very, that there's not much between the two things that are trying to exchange gases. And we really touched on this in the previous unit as well when we talked about how in the respiratory zone you have this very laminar, smooth gas flow, because once you move down into the respiratory zone, you do have these very delicate tissues, and they have to be delicate and thin. If they get to be too much thicker or tougher, you're not going to be able to diffuse gases across them. So it all kind of ties together because we want to be protecting the respiratory zone from high inflating pressures and causing shearing injuries and scarring injuries, because we don't want anything to compromise that gas diffusion. So this is kind of just a diagram to show you what I'm talking about here. So if this is the alveolar sac, you've got your PO2 here of 100, and then it shows you how it's diffusing into this venous blood where the pressure of oxygen is 40. So that's your gradient. The difference between 100 and 40 creates your gradient. If this were, let's say, 300, right? We did some experimenting with the alveolar air equation at higher than room air percentages of oxygen. So if this was, let's say, 300, this was going to rapidly diffuse even more, because that difference between 300 and 40 would be much larger. So that's kind of what Fick's law is talking about there. That would make for a more rapid diffusing gradient. When you're talking about that thin membrane, you're talking about this right here where the alveolar sac comes into contact with the capillary, and how you don't want this space to be thicker than it needs to. You want that gas to be able to move readily across that membrane. And then it's talking about surface area. So in this one, obviously, it just shows the one contact point. But if you see this alveoli nice and inflated here, and you can imagine it surrounded everywhere with a capillary bed for gas exchange, those are the components that we're going to be looking at. You can also see down here, it shows CO2 coming back to the lung in the venous blood supply. That's what this is. So this is the venous blood supply, and it's coming to the lung, and that CO2 is 46, and in the lung it's only 40. So that's your diffusion gradient. It's only 6. It's not as big, but it's still a difference in those pressures, and it's going to always want to go from high to low. So it's going to go from 46 down to the 40, and then that's how we're going to exhale that CO2. Okay, so this is just a slide where I take what I just said and I write it in words. This kind of occurred because in my previous class I had a student that really just was very, very technical. It was honestly really impressive, and really liked things written out in their entirety. So that's all this is what I just stated on the previous slide, written out in the most technical fashion. If this doesn't help your comprehension, don't feel like you have to kind of muddle through this. It's just so that you can kind of see the different numbers and what's happening. So again, the variables that we're going to be looking at for Fick's law for the practical application is we're going to be looking at pressure gradient, which is the difference between those two pressures, diffusion distance, or the thickness of the membrane between the alveoli and the capillary, and then surface area, which is just how much that alveoli is open up, inflated, and how much surface area it has to work with for gas exchange. I put this on here because there is a diffusion constant that Fick's law does talk about. We're not going to be doing much with that, really anything with that, so that's why I included it but then crossed it off. So really these are the three that we're going to spend a lot of time focusing on. The last law that we're kind of going to throw in the mix here is Henry's law. And Henry's law says that at a constant temperature, the amount of a given gas that dissolves in a liquid, or its solubility, is directly proportional to the partial pressure of the gas in equilibrium with the liquid. Good times, right? All you have to know about Henry's law, or what this means, is it's talking about how at a higher pressure, more gas is dissolved in a liquid. At a lower pressure, less gas is dissolved in a liquid. And I feel like the best example for this, because everybody can kind of relate to it in their mind, is if you think about a closed can of soda, it's under a lot of pressure, so that CO2, which is the dissolved liquid in the soda that makes it bubbly, is pushed into the liquid. That pressure is holding that CO2 into that liquid, and then that's what gives your soda fizz. Once you open that soda, and everybody's experienced this, whether it's a bottle or a can or whatever, when you open the soda and you let that pressure out, you've now allowed that CO2 to start escaping that liquid. It's not going to be as soluble once you remove that pressure. It's going to start bubbling out of that liquid. So that's how pressure relates to gas solubility. The other part of Henry's law, and again, I feel like this is something we can all kind of relate to, is temperature. So if you have a higher temperature, if something's warmer, gas is going to be less soluble in a liquid. And if something's cooler, gas is going to be more soluble in a liquid. And this is kind of the same analogy, but continued. If you open a can of soda or a bottle of soda and you put it in the refrigerator, it tends to not go flat quite as quickly. Whereas if you have that same can or bottle of soda and it's out on like a picnic table in the sun, because that temperature is going to be warmer and that liquid's going to increase its temperature, then that CO2 dissolves much, much more quickly. So colder temperature, more soluble in a liquid. Higher temperature or warmer temperature, less soluble in a liquid. And that's all we're going to do with Henry's law. This one is more applicable when we start talking about the transport of CO2 in the blood, which we're going to do in a couple PowerPoints, but that's all you have to know about Henry's law. So there are some limits for diffusion, and one of the limits that we have to talk about, besides some of the other things that we kind of have already discussed, is that there needs to be enough time for gas to diffuse. And when you think about how does this work in the body, if you have your blood flowing through your capillaries in your lungs, right, it's going to be moving through your lungs at a certain speed. And that speed or that blood flow is determined by your blood pressure. It's determined by your heart rate, which those two things can be determined by your activity level, your anxiety level, all kinds of things can change those. The practical example I'm going to give you for this is when we have COPD patients, generally speaking, when they're at rest, sitting in a chair or lying in bed, they can oxygenate much better than when they get up and move around. And the reason that is as they're starting to move, let's say walking to the bathroom, their heart rate is increasing, their blood pressure is increasing, that blood flow is increasing, and it's moving through their lungs more quickly. And so the level of oxygen they need is going to be much higher because they're moving and their muscles are requiring oxygen, but also they now have compromised it by not letting that bloodstream essentially keep contact with their lung tissue long enough to fully diffuse. Now, this isn't usually an issue for healthy adults. So if you're 20-something with no chronic disease process and you're running a marathon, you're going to increase your blood flow. It's not going to have the same contact time with your lung. But generally speaking, your surface area will be fine. Your diffusion gradient will be normal, going from high to low, as well as the fact that you should have a nice thin AC membrane that is great for gases participating in exchange between the lung and the bloodstream. If you're somebody who has a disease process like COPD, where some of those things might be compromised, and then you engage in activity that doesn't allow for that contact time to be as long as it could be, then you're going to start to see that oxygenation be affected. So this kind of is a diagram showing what I'm talking about. So you've got this capillary transit time, which is just speaking to the amount of time that blood flow is in contact with that alveoli. You can almost think of it as like a highway passing through. You've got like these red blood cells that are passing through, designed to pick up oxygen and drop off CO2. And when they start moving more quickly past that alveoli, they have less time for this diffusion to happen. In a healthy lung, healthy individual, that's normally not an issue. It's not going to affect their oxygenation. When you have any sort of compromise here where that diffusion is already potentially affected, then that decreased contact time can become much more problematic. So for a lot of COPDers that have a more severe disease process, they end up with supplemental oxygen. So they need to wear oxygen when they're walking around. And if you think about Fick's law, what that changes is that increases that gradient that we were talking about. It makes that pressure of 100 more like a pressure of 150 or a pressure of 200 in the lung. And it helps that oxygen to diffuse more quickly to kind of offset that capillary transit time. So this is not a graph that you have to know. This is just showing the AC or alveolar capillary PO2 gradient. So if the red blood cell is kind of passing and it's got that PO2 of 40 that I showed you, and it's passing through the lung and now it's leaving the lung, its average time spent there is 0.75 seconds. This is kind of like a good one to just throw on a flashcard for the boards, that the average capillary transit time for a red blood cell is 0.75 seconds. That's really about all that you'll use it for, is just kind of knowing that number. So if you were in a situation where your pulmonary blood flow was increasing and now your capillary transit time was 0.05 seconds, right? It's decreased, it's going past quicker, you could potentially decrease your oxygen. And this is just kind of the what ifs, taking you through what we just discussed. If you had an increased AC membrane thickness, that's also going to negatively impact that gas diffusion. What are some causes of increased blood flow? I think I already said some, but just kind of circling back. Exercise, anxiety, fear, adrenaline. There's lots of things that, anything that's going to increase your heart rate, essentially, or increase your blood pressure is going to increase your blood flow. So this is another one of those slides where I just write it out step by step in the most technical way. So you can read through this to kind of see how cell metabolism works. Essentially, your cell is going to deplete your oxygen. Your oxygen is going to want to diffuse into your capillary bloodstream and then go back down to your cells. This is not something that you guys have to memorize. This was just something that I had written out, particularly honestly for that student, but I think some people really do like the wordy definitions of how things are going. If that's not you, don't feel bad. It's not me either. You can just kind of skip over this slide. And then for the lecture questions, you'll notice that I spent a lot of time on Fick's law in the lecture questions. That's not an accident. It has the most clinical application. We're going to examine you on it the most. And it ends up having a lot of relevance when you're talking about disease processes and changes in ventilation. So almost all the questions but one have a version of Fick's law in it. Take that as a strong hint from your instructor for the exam. And when we go over the review, I'm going to try to use some drawings. I got a drawing pad. We're going to try to find ways to illustrate this law in more examples so that you guys feel really clear about what's happening here. And that is all I have for you for this one. As always, email me if you have any questions.